Hi everyone. In this part of lecture, we're going to talk about specific types of grief. You can see an outline here on this slide of the 6 specific types of grief that we'll be exploring in more depth. Learning about these will help you understand what your patients and their families may be experiencing, which will then provide us with insight and guidance into how best to offer our support and make appropriate referrals when necessary. Let's get started. Acute grief is a term that just means the person is experiencing the grief presently in response to a recent death or loss. They may be exhibiting any number of physical, emotional, cognitive, or behavioral reactions, such as those we learned about in the last part of the lecture on the slide that had the 4 boxes. Depending upon the circumstances, people may feel as though they're coping quite well with the loss, or they may feel as though they're really struggling. Another facet that plays a critical role for many but often gets overlooked or avoided is that of spirituality. We talked about how someone may have specific religious practices or customs that need to take place, but I'm talking here about that inner quest for meaning and purpose in life as well. It's very common for people to struggle with these bigger questions about life and death and about how they'll be able to adjust. Sometimes people feel this brings them strength, while others may feel this brings them more confusion and despair. Each person is different. Many say that God is the only thing that got them through the tough times, whereas others will say that they're having a hard time believing in God now that such a horrible thing has happened. Both responses are normal and okay. It just indicates that the person is struggling to reconcile these matters of life and death. This is one of the reasons why it's important to have healthy outlets and support. Simple things like reminding grieving families of the importance in eating a well-balanced diet, getting enough rest at night, trying to squeeze in some exercise, or having at least one person they can talk with are so helpful. Most importantly, we need to again remember that these varied physical, emotional, cognitive, and behavioral, as well as spiritual responses are normal and expected following a significant loss. Anticipatory grief is a phrase we use to imply that the patient and our family are grieving even before the loss or death occurs. What different examples might you be able to think of? When might someone already start to grieve the loss of hopes and dreams, of a future together, of plans that will go unaccomplished? Maybe someone has a chronic or terminal illness. Maybe they've learned that their unborn baby has genetic abnormalities that are incompatible with life. Maybe their parent or grandparent is diagnosed with Alzheimer's or some other form of dementia or cognitive impairment that results in part of that patient's personality dying before their body physically does. There are lots of examples we could come up with, but these are just a few to get you thinking. When we consider it, there are both pros and cons to anticipatory grief, and I've listed some here for you on the slide. On one hand, it's nice to have time to prepare for someone's death. This may involve preparing emotionally, socially, even financially. Maybe this will give you time to process with the person who's dying, and you can both discuss and listen to one another's goals, hopes, fears, and concerns. Having a little time also brings opportunities to make amends or take care of any unfinished business before a good death can occur. On the flip side, knowing someone is going to die can be very exhausting and stressful, especially if you're someone who's always worried or uncertain. It's hard to know that we have no control over what's happening now or what will happen in the future, and that can be both anxiety-provoking and depressing for many. It's hard to watch someone we care about suffer and decline, and this can take its toll on someone, particularly if they're a primary caregiver. This can also lead us to detach from the patient, or for the patient to detach from their family, because they think subconsciously that they're buffering themselves or others from the dying process, or because it's simply too hard for them. In healthcare, anticipatory grief often isn't allowed because we have so much focus on curing and saving that we miss really valuable opportunities to listen and support families with where they're really at on their grief journey. It's almost as if we send the message that if they talk about the person dying, that they're wishing it upon them faster or that they're betraying them. In reality, many people just need to feel how they feel and be where they're at in that process of life and death. It doesn't mean someone's bad for feeling that way. It's very normal. Disenfranchised grief occurs when there's a death that is not or cannot be openly acknowledged, socially supported, or publicly mourned. Let's think of different examples. Maybe someone dies and they weren't legally married to their partner, and suddenly others don't see their grief as important or legitimate as others in the family. Maybe there was some type of scandal involved, such as an affair or a child born out of wedlock. Is that lover or child denied the same respect and opportunity to grieve? What if someone loses a baby to miscarriage or stillbirth? Do others just say, well, you can have another baby, or you should be glad you already have a child, rather than acknowledging the pain and loss that those parents are now experiencing? Are there children who are grieving, and people assume that since they're little, they can't possibly understand or have emotions and questions about the person who died? Are they forbidden to attend the funeral? What about people with cognitive disabilities? Do others assume that they can't understand or they don't need support, and thus just overlook or ignore the fact that someone important to them died? What if someone has a same-sex partner and their family or community don't recognize their loss of the relationship? Is someone dying of AIDS or another disease that carries stigma or shame, and thus their life is not honored and memorialized in the same fashion? What if your parent or spouse was killed in the line of duty? They're suddenly a hero, and people want to see you proud, not sad and crying. The list could go on, but I hope you get the idea. Not everyone's life or loss is recognized and valued as much as other losses, and thus the people grieving that death are left without the same support, opportunities, or resources as those who are viewed as more worthy or deserving of their grief experience. As a result, many people who are disenfranchised in this way never have a chance to really cope with or resolve their grief. Instead, they may feel as though they can't talk about it. They may never be able to move forward with their life in a healthy way. They may repress their pain and sorrow to a point that's not healthy. Regardless of who you are and the loss you are experiencing, everyone needs an opportunity to talk about it and have someone listen and offer support. Now that we've looked at acute grief and disenfranchised grief, let's talk about traumatic grief. As the name implies, there's some type of trauma involved. What we need to understand is that the person or family needs to deal with the trauma first, and then they can start to grieve the loss. For example, if someone is murdered in front of their family, the fact that they saw and experienced such horrible things needs to be dealt with before they can ever hope to start working through the grief that's also associated with that death. Most people in the community don't understand this, and it's doing a real disservice to people. So what are some elements we need to consider in terms of how a death may be considered a traumatic one? First, we have to look at the nature of the death. This is similar to what we looked at in the last lecture. How did the person die? When there's trauma involved, it's almost always premature, unexpected, and calamitous, or senseless and destructive. This leads to a heightened sense of unreality, especially if someone is reliving that trauma over and over again, whether it be in their thoughts or dreams, or through repeated comments by others or coverage by the media that never seems to give them a break from what's happened. On this slide, we can see how this sense of heightened unreality impacts people. Trauma is complex. It doesn't make sense, it's overwhelming, it's scary, and it leaves people feeling helpless and afraid. Traumatic grief may lead to loss overload, where it's not just the fact the person died, but all these other aspects of the trauma experience begin to compound. People may lose the sense of emotional and physical security. They may not feel like themselves anymore, or as though part of them died as well. Many times, families experiencing a traumatic death demonstrate an increased need to try to understand what's happened. The world no longer feels safe. It doesn't make sense anymore. They begin to question and wonder, what if this, or if only I'd done or said that. And because a lot of traumatic deaths, such as homicide, suicide, or deaths where a law was broken, such as a drunk driving accident, have social stigmas attached, survivors are often left to grieve alone. We also see victim blaming quite frequently, as society will blame the person who died for their death, saying things like, well, she shouldn't have been drinking and driving, or gee, he shouldn't have gotten caught up in the wrong crowd. These comments don't help, but rather they can make families feel even more isolated and ostracized. Complicated grief is a more generalized phrase that refers to situations in which a grief reaction has become more debilitating than normal. At first, many of the signs and symptoms with grief and complicated grief are the same, but over time we'll see people who experience complicated grief as getting stuck. They may fixate on certain memories or aspects of the person who died. They may yearn and long for them in a way that prevents them from having any other interactions with others or from trying to continue to live their daily life. Some situations can make complicated grief more likely to occur, including if it was a violent death, a suicide, if they have a limited support system in place, if there were any previously traumatic experiences during their childhood, or if they have a dependent personality. Certainly, most people do not experience complicated grief, but for those who already have a lot of other really tough things on their plate, it may be more likely that they would then struggle to cope with a recent death as well. Even though some factors may increase the likelihood of grief developing into a more complicated form, this is relatively uncommon. That being said, we do need to be aware of how this impacts people, not just emotionally, but mentally, socially, and physically as well. Here we can see that people suffering through complicated grief may be at higher risk for depression, suicidal ideations, increase in rates of heart disease, cancer, or high blood pressure, as well as substance abuse, anxiety, and difficulty functioning on a daily basis. Sometimes, and for many reasons, including some we've already discussed, people aren't able to really show their emotions and how they're doing inside. Our society expects us to all accept the death and move on as if nothing happened, at least after a short period of time, and what results is that there are many emotions and thoughts that go unaddressed. It doesn't have to be an all-or-nothing approach when it comes to grief. There's a lot of in-between. What about feelings like hurt, fear, anger, guilt, or depression? When someone's grief is not acknowledged or allowed to be expressed, that can build up into both invisible anger and unresolved grief. This leaves someone in a position where they're experiencing intense, distressing emotions and they have no outlet for release. This can be dangerous, not just for that person, but for others as well. Resentment can build and anger can amplify, placing them at a higher risk for violence. In spite of this, there are many helpful resources that can assist patients and families in dealing with all kinds of losses and in various degrees. As we said earlier, there's no one approach that's going to work for everyone. That's why it's important that you as healthcare professionals be aware of a variety of grief resources that may benefit your patient or their family. Here are some examples of national organizations as well as local ones. Also note that many of the national ones have local chapters that I did not include on the slide. These are just some to think about. But what other resources can you think of? For those of you who live outside of Omaha or a different state entirely, what resources are available in your community? How could you make patients and families aware of what there is to offer? Could you gather some brochures or flyers to have on hand? Could you post information about upcoming support groups or good grief counselors in public areas for families to view? Could a chaplain or social worker be available to listen or offer referrals? Let's start making a list of resources so you'll have something tangible you can come back to even when this class is over.